Okay, let's unpack this. We have been handed an incredibly detailed stack of source material today.
We have.
A real deep dive into the philosophy and, the practical applications of a specific chiropractic model. This one's led by Dr. Tyler Antignolo.
Right.
But we aren't here just to review one practice. We're here to pull out the core principles, to really see what defines a truly holistic approach to health.
And that's our mission, really. We're
Mhm.
synthesizing this material to give you, the learner, a full picture of the scope of service, yes, but maybe more importantly, the underlying belief system.
The belief about the body's phenomenal innate healing capacity.
Exactly. We want to know not just what adjustments are being performed, but why they approach these complex issues like chronic pain or even digestion, lack of focus, why they come at it from a spinal perspective.
And the sources, they set a pretty high bar. They promise a natural path to vibrant health, balance, and feeling your absolute best.
It's a big claim.
It is, and it's for everyone, from those in pain to families seeking wellness. That level of aspiration, it demands we really analyze their method.
It does, and the defining focus is clear right from the start. Optimizing health by prioritizing the spine and the nervous system. They see this system as the body's master control network.
The command center.
Pretty much. But before we get into the philosophy, there is one really important practical context we need to set. It speaks to their scope.
Okay.
While this model is holistic in its intent, at addressing how the nervous system impacts overall function, it's important to remember that the care, by definition, is focused on musculoskeletal conditions.
That's a key distinction right there. It places the work firmly in the realm of restoring movement and alignment to optimize that control network.
Yes.
And speaking of practicalities, for those of you who might want to check out the services mentioned, they do explicitly state they accept Blue Cross, Blue Shield, and personal injury cases.
Good to know up front.
Yeah.
Absolutely. But okay, let's get into the philosophical engine driving this model, because this is where I think the analytical separation really happens.
This is the core of it.
Dr. Antignolo's work is guided by a principle that just dramatically shifts the focus away from, well, superficial relief.
And that guiding principle is what we pulled out as the central idea. Pain is a signal, not the source. If you stop and really think about that for a second, it fundamentally changes how you approach healthcare.
Precisely. In, conventional settings, we often seek to just silence the signal.
With medication or a procedure.
Right, aimed only at the site of the pain. This model suggests that if you just silence the alarm, you haven't fixed the fire.
That's a great way to put it.
Their job, as defined in the source material, is to act as a detective, finding what's causing the discomfort, which is often tied to a spine that's, well, not moving as it should.
But doesn't that sound almost too good to be true? If the spine fixes focus, energy, and digestion, why isn't this the standard primary care model?
Well, I think it's about how they define healing. The sources really stress the body's innate ability to heal.
Okay.
So if we zoom out on the nervous system, it's the connection between the central nervous system, the brain and spinal cord, and the peripheral nervous system, which is all the nerves going everywhere else.
Right.
When the spine is structurally misaligned, what's known as a subluxation, it can interfere with that communication line. It might not even cause direct pain right away, but it reduces the quality of the signals being sent.
So the misaligned spine is basically creating static on the line.
That's a perfect analogy.
It's static between the brain and the rest of the body. So by restoring that alignment, they're just reducing the static, which lets the body's natural intelligence, that innate ability, operate at full capacity.
That's the mechanism. They aim to support the body's own natural wisdom. And this is why the benefits they talk about in the sources go so far beyond just musculoskeletal symptoms.
They're not just targeting a stiff neck.
Not at all. They're optimizing the entire system. When you improve the clarity of the nervous system, you see these knock-on effects, like improved energy, better focus, even better digestive function, because these are all processes regulated by that master network.
It just completely transitions the conversation from damage control to, performance optimization.
Yes.
It's about moving from, I'm in pain, I need help, to, I feel fine, but I want to feel absolutely amazing.
Exactly.
It's about empowering the patient to feel like their best self from the inside out and to live life fully without, a bottleneck in their central communication system.
Precisely. The focus is on functionality and longevity. So if that's the underlying philosophy, let's look at the practical application of it.
How it works in the real world.
Right. And the sources are organized pretty clearly around 4 major service categories, which really shows the breadth of people they serve with this one focused approach.
Okay, let's start with the one everyone recognizes,
Yeah,
pain relief. This is the direct response to that alarm signal we talked about.
right. This category covers all the common acute issues. Things like sciatica, recurring headaches, or that, generalized low backache,
The stuff that gets you to pick up the phone.
the stuff that gets you in the door. The approach here is described as gentle care, and it's designed to restore that segmental movement and ease discomfort naturally. The goal is rapid, effective relief, but, and this is critical, it's relief achieved by fixing the underlying cause of the stiffness, not just treating the symptom.
And the second category shows that the analysis doesn't just stop at the spine itself,
No, it goes to extremity pain.
which confirms they are treating the full mechanical system.
And this is a really crucial distinction, especially for the technically minded listener. Extremity care means treating issues beyond the axial skeleton. So, shoulder, elbow, hip, knee, or ankle pain.
Like a sports injury.
Yeah, think about the weekend warrior or the athlete dealing with a repetitive strain injury. Often, that shoulder issue is just compensating for a restricted mid-back, or maybe that chronic knee pain is related to a pelvic misalignment.
Ah, so it's all connected.
It's a kinetic chain. The care here focuses on unlocking mobility and strength by viewing the body as that whole chain, making sure all those joints are functioning optimally.
And then you have the proactive element, which I think resonates really strongly with anyone who values prevention, wellness care.
This is where the holistic philosophy just shines. Wellness care is explicitly for those who are not in pain but want to stay that way.
I love that.
The alignment focus here isn't about fixing an emergency, it's about maintenance. It's about keeping the nervous system clear to boost your baseline functionality.
And the sources mention specific benefits.
They do. They cite things like improved immunity, better quality sleep, and just increased overall vitality. It's about creating a robust internal environment, not just reacting when something fails.
And finally, they integrate all of this into a model that supports the whole family.
Across the entire lifespan, yeah, family care.
This really rounds out the whole holistic scope, doesn't it?
It really does. The sources detail comprehensive care for all ages, from little ones with growing pains to grandparents staying active. They emphasize safe, gentle adjustments tailored for children, supporting them through rapid growth phases and common childhood issues.
So it reinforces this idea that health is a continuous family adventure.
And it's best supported proactively.
So when you put those 4 together, treating acute pain, handling the peripheral joint issues, offering preventative wellness, and supporting every age, it's clear they're applying one single root cause philosophy across a huge spectrum of human need.
Absolutely. And moving from the services they offer to the actual patient journey, the sources detail a very structured process.
Which is good.
It is, because it addresses a common pain point,
Mm.
the anxiety of trying a new health modality. They lay out a clear 3-step introductory process.
That clarity is so important, especially when you're dealing with something as central as your own nervous system. So what's the first step in that journey?
Step 1 is the comprehensive consultation and exam. This involves reviewing the patient's complete health history and then doing a full spinal and nervous system evaluation.
Okay.
And the key analytical takeaway here is the commitment to diagnostics. This evaluation includes X-rays, if they're needed, to accurately locate the issues, which is so critical for moving beyond just guesswork.
That focus on objective data, the X-ray diagnostics, that reinforces the commitment to finding the source, right? Not just responding to the signal.
Exactly.
And what about the actual treatment?
Well, unlike some models, they aim to begin treatment relatively quickly. So step 2 is receiving the first adjustment, if it's clinically appropriate based on that exam, of course.
So you could get an adjustment on day 1.
You could. It's described as gentle, effective, and focused on real change. The idea is the patient doesn't walk out having only been examined. They experience that first step toward correction.
And the final step brings everything together.
Step 3 is the personalized plan. And this isn't generic. It's tailored specifically to the patient's body, their history, their healing goals. The analysis of the X-rays, the initial findings, the treatment strategy, it's all reviewed in detail during a follow-up visit.
And that's where the transparency becomes paramount.
It has to be. And that commitment to transparency is so strongly reflected in the patient testimonials they included.
Right, and they aren't just vague endorsements. They really focus on the atmosphere and the level of care.
Exactly. We see these recurring themes. Patients feel genuinely listened to, they feel welcomed, cared for. Dr. Tyler himself is consistently praised for being kind-hearted and deeply knowledgeable.
That's high praise.
And what really seems to build trust, as you see in the reviews, is the detailed explanation. Patients emphasize that he takes the time to thoroughly explain their condition, walking them through their own x-rays, making sure they understand the why behind the plan.
That takes time, which speaks volumes in today's, rapid-fire healthcare environment.
It does.
The sources also mention the commitment to accommodating urgent reschedule and emergency requests, which shows a pretty significant level of dedication to accessibility.
It really does. And this attention to the overall patient environment is highlighted by that fantastic little detail we found in one review.
Oh, I know which one you mean.
The note that says, P.S. He always has the best music to relax you.
I love that.
It's subtle, but it's a powerful insight. It tells you the entire atmosphere is intentional. It's designed to reduce stress and promote healing because they know that a relaxed state is essential for good vagal tone and nervous system response.
That connects right back to the whole holistic philosophy. Trust is built on clarity, especially in healthcare, and discussing every cost, every step so there are no surprises just supports that whole environment.
Precisely. Now, for the learner, we need to transition into the analytical edge, those detailed insights that really prove this commitment to education and systems-based understanding.
And the doctor's recent educational articles provide exactly those knowledge nuggets.
They're perfect.
So let's start with the one that helps delineate symptoms. The distinction between sciatica and just, generalized low back pain. Why is that specific distinction so important for treatment?
Well, this differentiation moves the treatment from just general musculoskeletal comfort to really targeted neurological care.
Okay.
So while the terms overlap, the sources highlight that true sciatica involves irritation or compression of the sciatic nerve root, which often causes symptoms that radiate down the leg.
That tingling or numbness.
That's the one. And knowing this distinction through a proper diagnostic evaluation is crucial because the relief steps, whether it's adjustments, mobilization, specific exercises, they need to address the nerve impingement site, not just the tight muscles in the low back. It's the difference between treating a general ache and targeting a specific nerve pathway.
That level of detail, again, confirms that diagnostic commitment we saw earlier. But I think the most sophisticated analytical nugget, and maybe the perfect capstone to understanding their holistic approach, is the focus on the vagus nerve.
This is the hidden superpower, as they call it.
Right.
The vagus nerve is cranial nerve X. It's the longest cranial nerve, and it's responsible for regulating the vast majority of our parasympathetic nervous system, our rest and digest mode.
And its influence is just huge.
Listen to this again from the sources. It touches the heart, the lungs, the gut, the immune system, your mood, and even how connected you feel to other people.
That is an astonishing reach. But if the vagus nerve starts in the brainstem and travels all the way down to the abdomen, how does adjusting the spine influence a nerve with such a massive distributed job?
It's often related to the upper cervical spine, specifically the atlas C1 and the axis C2.
The very top.
Right at the top. These vertebrae are situated immediately around the brainstem and the pathway of the vagus nerve. So if there's a misalignment or a restriction in this very delicate critical area, it can negatively impact what's called vagal tone.
And good vagal tone is what you want.
It's what you want. It's the capacity of your nervous system to switch quickly from fight or flight to rest and digest.
So if the alignment is off, it can interfere with the vagus nerve's ability to send those calming signals.
Exactly.
Which could then manifest not as a stiff neck, but as, poor digestion or anxiety or chronic inflammatory issues.
That's the connection. That's the powerful connection.
Yep.
It connects functional anatomy directly to emotional well-being and visceral health. This focus on detailed, systems-based insights, like the x-rays and the neurological function, is what provides the foundation for their whole holistic treatment plan.
And it gives the patient the context they need to fully understand the recovery process.
It elevates it far beyond just a simple musculoskeletal fix.
So what does this all really mean for you, the learner? Our deep dive today, it confirms that this specific approach centers on analytical detection, on finding the root cause.
Which is usually the spine not moving correctly.
Right. And doing that unlocks the body's ability to improve far more than just pain symptoms. It supports better energy, focus, sleep, overall system function.
I think the main discovery is just the confidence in the body's powerful self-healing capacity. And if the model is built on the premise that the body possesses this profound innate ability to heal that the practice tries to tap into, this raises a really important provocative question for you to think about.
Oh.
If a small interference in the nervous system can have such widespread negative effects, what might be the collective limiting factors in our busy daily lives? Chronic stress, poor posture at a desk, repetitive strain that are constantly pulling our innate healing power down from 100% capacity, even when we aren't experiencing major obvious pain.
A profound thought to consider as you reflect on how you maintain balance in your own master control system. That wraps up our dive into the source material you provided, unpacking the philosophy and application of this holistic approach to health.
Thank you for the insights. Until the next deep dive, stay curious and focus on the source of the signal.